Wow. Sorry.
Good afternoon. Global health is no longer a field that's about experts in high-income countries going out to solve problems in low and middle-income countries. It's not about Duke going out to save the rest of the world. We know that real progress happens when we engage in bidirectional learning, when we find great partners around the world, like the ones that are here in the room today, and learn from them in the same way that we bring our resources and expertise to the table. You've heard great examples today of technologies, of solutions that were developed by students, faculty, others at Duke that are now going out to the rest of the world. And I'm going to tell you a very different type of story. We know that if we're going to get to this grand convergence in health that you've heard about, we have to recognize that our systems and challenges are more similar than they are alike. Structurally, we know that we have to deal with improving access to health and related services for everyone equitably. We know we have challenges in quality everywhere in the world, including here in Durham, North Carolina. And we know that affordability continues to be a challenge anywhere people are seeking health services. At the same time, you've heard today about what's coming down the road, the growth in non-communicable diseases, with the majority of that burden happening in low and middle-income countries. The need to recognize the challenges in mental health and combine that with the way we approach physical health, and changing demographics and rapidly aging societies that are putting pressure on the health and the vibrancy of economies around the world. In that context, when we look at the world, it's easy to see the darkness, the gaps. But I want you to think differently. I want us to think about the bright spots. Because in the middle of that darkness, there are solutions, there are talented people, there are innovators that are solving challenges. And we know that in the most resource-constrained settings, some of the most creative and transformational solutions are actually coming into place. And I'm going to tell you about 3 of these bright spots today. And the first is from Bangalore, India. Dr. David Shetty, over 15 years ago, recognized the need in India to offer high-quality and affordable services for people with heart problems. Could you imagine a model from the US where we spend $50,000 to $100,000 to do an open heart surgery being affordable for everyone in India that needs it? Instead, he said, we're going to redesign, we're going to disrupt, and we're going to transform what we do. And that's exactly what they've done. They are now showing that they can do open heart surgeries with the same outcomes, the same quality as we get in the US for $2,000, not $100,000. And not only that, we know that they can disrupt other parts of the world. And to be relevant for the US, they've gone here, the Cayman Islands, to show that in a partnership with Ascension Health, they can make available the same high-quality services to half the US population within a 4-hour flight and provide these services for less than a third of what it costs in the US. The second bright spot comes to us from Kenya, recognizing the stigma and the isolation of people with mental health challenges. An organization called Basic Needs has built a model that works not just in Kenya, but in 11 other countries around Asia and Africa, reintegrating people, providing community-based mental health services, but also vocational training and building research and evidence that people can share. That's a model the US needs. And that's exactly why we've been working for the last year with Basic Needs to plan to bring it to the US, and it's now moving forward in a demonstration in Detroit, a part of the US that in the last 10 years has gone through urban blight and now urban revitalization, a place where, working with Southwest Solutions, a local partner, we can show that solutions can transfer in unexpected ways, in reverse ways of what we might imagine, from low resource settings to high resource settings. And the third bright spot comes to us from Mexico. How many of us, when we have a medical question, want to make an appointment, go miss a day of work, go drive to a clinic, wait for 2 hours to get our 12 minutes with a doctor. If you're part of Medi-Call Home, you can pay $5 a month and you get unlimited access 24 hours a day to call and talk to a doctor. And they've now shown that with more than 10 million phone calls, that they can answer 2/3 of the questions that people have without ever sending them to doctors in person. And now they've moved this model to the US, where we have more than 50 million Hispanics that live in the US, the majority of whom speak Spanish at home, and for whom there's real difficulty in accessing culturally and language-appropriate care. So through a model called Consejo Sano, they've brought to the US the ability for people to get culturally competent care that's actually more affordable and more aligned to their needs. This is the idea that we're really going to try to push more. Not that innovation happens in high technology areas and then gets diffused to the rest of the world that doesn't have it, but the opposite. Thinking about reverse innovation, what can we learn here in Durham, North Carolina from what's happening in Delhi or Nairobi and use it to improve access and quality and affordability for our own communities? And we know that to do this well, we have to be able to curate the very best innovations anywhere in the world, that we have to then be able to adapt them to be culturally and contextually appropriate, that we have to be able to show and demonstrate and create evidence of their effectiveness, and just as importantly, we have to be able to scale the impact. And you heard over the lunch after conversation today about the incredible opportunity that a place like Duke has. Where else but a place like Duke can pull all of this together? If not us, whom? We know that through the Duke Global Health Institute, we have incredible partnerships and collaborations around the world. We have partners here with us today from whom we should be learning. We also host a nonprofit here that's called Innovations in Healthcare, that's focused on identifying and supporting innovators like the ones I talked about all over the world. We work with 67 similar organizations, helping them to scale their impact all over the world. And we know now that today we're going to be launching a new Global Health Innovation Center that will be part of our Global Health Institute, but also will bring together the Duke Margolis Center for Health Policy, the Duke Institute for Health Innovation, and many other parts of Duke. So together, we're really going to try to create a hub for this type of innovation, to find it, to nurture it, and to scale it everywhere in the world that's needed, including right here. So when we look at the world, I hope that we come away not looking at the darkness, but really looking for bright spots, and especially recognizing that those bright spots can happen in the most unexpected ways and can travel in very unexpected directions. So together, we can really make this happen with our partnership, with our students, with our faculty, so engage with us, and together we can lead to a brighter and a healthier world. Thank you.